Hi everyone. So I recently had the opportunity to attend a series of meetings covering a range of disciplines, but mostly falling into the domains of advocacy and public health. There were topics such as youth political participation, mental health, and cancer awareness. However, a common thread I noticed was how many new and innovative healthcare solutions exist or are in development, but have yet to gain the level of public support needed to make them available and widespread. So today I'd like to share something new I learned about precision medicine and its role in mitigating the harm of cancer. It all starts with Kyle DeLeon. Kyle's a senior manager for the state and local advocacy for the American Cancer Society's Cancer Action Network, or ASC-CAN, here in Texas. He's also a cancer survivor himself, and during his presentation he talked about many things related to advocating for better healthcare, support for cancer patients, and what the organization he belongs to does. However, one thing in particular that stood out to me was a technology called biomarkers. In essence, biomarker testing is an element of precision medicine that can track various physiological processes in the human body that indicate its overall health. What this means is that an individual patient's unique response to a medication or disease can be monitored and addressed accordingly, and that's crucial to effective precision medicine. It's not just useful in cancer, but it has applications in a wide variety of medical disciplines and has significant ramifications for the future of healthcare. By knowing exactly what's going on in a patient's body and knowing how to deal with it, hospitals save money on trying different treatments that may or may not work, and don't have to go through the tedious blood work and other traditional analyses of what the body's going through. Cancer has had a minimal impact on my personal life so far though, so I think I'll let Kyle explain how increasing biomarker accessibility will improve the lives of those suffering from cancer.
I know this is a lot of information here, but I want you guys to really think about the fact that there's so much happening. There's so much happening where they are here in January, we see that the patient only, or their insurance only covers testing for ALK and EGFR, and no mutations were found there. So that's not all the biomarker testing that this patient needed. They went through 5 cycles of chemoimmunotherapy, which caused negative health effects on them, ended up in the ER, ended up with a rebiopsy because they're still clearly sick. Then they're trying on, then after that in July, they end up on a combination chemotherapy, but they have to stop due to side effects. Later on in the summer, they end up switching to another chemotherapy drug, and then another biopsy happening in November, ultimately leading with December, this patient has access to targeted therapy or targeted oral therapy for their unique disease. And this is so many hoops that this patient had to go through. It's a real hassle. As a cancer survivor myself, I didn't have to go through all of these, but my cancer was not one that had biomarker testing available for it. I really had a shotgun blast approach of chemotherapy. With biomarker testing in January, this patient got the testing that they needed for all the biomarkers that could be impacted, and then they ended up on their targeted therapy. And that's it. Now, to go back on this is life without biomarker testing, and it is time consuming, it is expensive, it's mentally taxing, it is exhausting. But with biomarker testing, I'm not going to say that it's a walk in the park. This patient is still living with a life-limiting disease, but they're under a targeted therapy regimen that is designed for them.
Thanks, Kyle. To provide some more context, precision medicine, also called personalized medicine, is medicine that takes into account each person's unique features and is thus better able to treat their body effectively. Through gene and protein modifications, biomarkers inform medical professionals treating a patient of what's wrong, allowing them to get straight to saving people's lives. I'd also like to introduce Dr. Beverly Gor, who I had the pleasure of meeting and who is a retired public health and nutrition consultant, as well as a registered dietitian with a doctorate in health education. As someone who's older and at higher risk of developing cancer, here's why precision medicine matters to her.
Precision medicine matters to me because it will provide a more exact and personalized treatment for individuals. This will not only save lives, but also save time and money because resources will not be wasted on trial and error treatment. I am also very interested in the biological and environmental exposures each of us has had over our lifetimes. This impacts our disease risk, the foods we tolerate the best, and the medications that might benefit us the most when we get sick.
But while this is all very cool, it still doesn't directly have a role in my life right now. As a person who's less likely to develop cancer, why should someone like me still care? Well, just because it's not here in my life yet doesn't mean it's not going to be in the future. According to Families USA, compared to non-Hispanic whites, Asian Americans are 76% and 53% more likely to develop stomach cancer among women and men respectively, and at least twice as likely to die from it. People like me are 72% and 66% more likely to develop liver cancer for women and men respectively as well. These are just two of the many increased health risks that those similar to me possess, with more related to diabetes, obesity, hepatitis, tuberculosis, and prenatal care. All of these are areas that biomarkers and precision medicine can have applications in, so why not invest in my potential future illness as well as the current ailments of people like me? In addition, Asian Americans are the only racial/ethnic group in the US for whom cancer is the leading cause of death among both sexes, for a variety of reasons. The countries we come from aren't necessarily the healthiest places to live. The types of food our families have adapted to eat might not be as available here in the US. We might not be able to speak the language as well and therefore might not get what doctors tell us. Not all of these can be solved by biomarkers or precision medicine. However, when we do need medical attention, it's imperative that anyone can access these life-saving measures, which requires research and information on how these technologies affect different people, as well as what risks to expect. But therein lies another issue. Asian Americans are underrepresented in medical trials and studies, even as the Asian percentage of the American population increases faster than any other ethnic group. If there's a chance I'm going to need precision medicine to save my life, I'd like the people treating me to have the information they need to do their jobs. Just knowing about the cancer risks I inherently have just by being Asian has certainly informed me of health concerns that I need to watch out for in my own life. And if that can't prevent me from getting it, I would sure hope at that point biomarkers and precision medicine are accessible enough for me to receive treatment. So yeah, it turns out cancer is something that everyone has to look out for. There are risks that we are all predisposed to based on where we live, the genes we inherit from our family, the habits we develop, and all manner of things that add to the uncertainty and make cancer such a tricky disease to deal with. Even though I like to think of myself as young and unlikely to develop a tumor, that's not always going to be the case, and it's in my own self-interest to be informed about and advocate for advancements in precision medicine that may save the life of my future self. Get involved. Signing up for the American Cancer Society newsletter is an easy way to stay updated on important bills being sponsored that will open up access to new life-saving technologies for more people. After all, if we want our government to be held accountable and work for us, it's our responsibility to be active and participate in a way that ensures our voices have an impact. Let's hear one more time from Dr. Gor about why it's important for younger people to be informed about advancements in precision medicine.
The whole field of medicine and health is moving towards a personalized and more precise approach to how we prevent and treat disease. So it's important that healthy young people are aware of their family history, practice healthy lifestyle behaviors, including good nutrition, regular exercise, stress management, avoiding tobacco, alcohol, and substance abuse to prevent or reduce the risk for chronic diseases like cancer. However, if they do develop an illness or chronic disease, they will be aware of possible genetic predispositions and the physical exposures they may have experienced from their environment. That knowledge may help doctors in designing a personalized and optimal plan of care for him or her.